Hello, hello. Uta Hagen here of Trans Widow Uta Hagen YouTube channel and WordPress blog, utahagengrasswidow.wordpress.com. That is always in the notes, and that's where the contact form is. And I do encourage anyone who has divorced a suddenly demanding cross-dressing husband or partner to contact me with your story and fill out the answers to my survey, 20 questions to ask a trans widow. No one else has data in the whole world on as many trans widows as I do, and I want to increase the statistics that we have. So this is my first big full daffodil bouquet. I especially love these ones that have some orange in them. And there are going to be some other varieties coming into bloom. So that will be and it's also very fragrant. That will be part of our background. Now, I am the author of my memoir, In the Curated Woods, True Tales from a Grass Widow, which includes a great deal of information about how I went about healing my trauma from the financial abuse and emotional abuse and narcissistic abuse of my ex-husband, Nettie, when afterwards, after he was so-called diagnosed with his trans so-called identity, uh, uh, I tumbled into constant worry about money, which thank goodness I no longer have, and constant worry about my sons, who are unfortunately distancing themselves from me, but who are completely intact. And I do believe I can take credit for that. Now, I just want you to know that in my book are many, many photos, 50 photos of my woods and the nature here. And I am going to just slowly uh, walk into and walk us through my reaction to this expose of the charlatans in the World Professional Association of Transgender Health, WPATH, which Michael Schellenberger and Mia Hughes have just so thoroughly and excellently presented the leaked information from those uh, Zoom meetings and those emails and so on internally in this organization, where these doctors, endocrinologists, etc., are ignoring extreme mental health, psychiatric problems that are coexisting, such as schizophrenia, such as drug and alcohol abuse, such as autism, and other difficulties with mental health that these patients have. And these coexisting psychiatric illnesses are not being addressed. These doctors are promoting the false idea that every problem that any patient has can be solved by the prescription of wrong sex hormones, or if it's a child, the prescription of first puberty blockers, and then later wrong sex hormones, and then go on a pathway towards surgeries which alter the urinary tract and have a much too high rate of dangerous, harmful, iatrogenic uh, uh, side effects, you could call them. I think that they are actually main effects. I think to call it side effects is almost like a euphemism. Everything is euphemism and captured language in so-called trans world. And what I can present now is a little bit more background into the whole mental health universe and the overemphasis on drugs. And I know this because there have been doctors, even just regular general practitioners, who told me if I gave them some background in the fact that I discovered my now ex-husband's cross-dressing diaries when my sons were 1 and 4 and that I was devastated, they immediately want to put me on some kind of serotonin reuptake inhibitor, SSRI, and tell me that I must have depression when in fact my PTSD was an anxiety problem. I have much less of it now, and I think that part of the reason that I am better than even at the time when I first started this channel, maybe you could even see it if you look at some of my old videos, you probably can see um, a, a growth in confidence. You can probably hear it in my voice. And I feel that what I have done is to strengthen the positive pathways in my brain through my work outside and through helping people here, through telling the stories of the trans widows. And I went through a process of really kind of being devastated when I got the answers of my survey, 20 questions to ask a trans widow. And for many women, for over a third of us, we now have 57. I certainly would like more. I invite everyone to let an ex-wife like me know. If you have a friend who went through this variety of divorce, please urge them to visit my channel. And what I can say is that I've developed a much more nuanced and stronger ability to absorb the difficult stories, the details. Unfortunately, out of the 57 of us, over 1/3 were sexually assaulted by the lace panty wearing, lipstick wearing, demanding, suddenly cross dressing husband because of this whole emphasis on sex role play and also the influence of hypnosissy porn, which of course I didn't know anything about. Uh, in the early 1990s, when I was finding out about my then husband's, the father of my 2 sons, so-called diagnosis, um, and I just feel so much stronger. I really believe in the Nordic walking with my Lecky walking sticks, which were designed to do summer training for cross-country skiing. There's something very uplifting about that for me. And I have especially been focusing on healthy eating and good sleep habits and my work out in nature, my enjoyment of the birds and the butterflies, and feeling that I have a sense of mission. Now, I would just recommend to any one who is dealing with negative feelings or anxiety, trauma, or any mental health practitioner who is helping people through that, please try holistic activities first and have faith that it might take 2 years. You might have been feeling anxious and depressed for decades. And if you can figure out to solve the problems that are still causing you, tripping up your fears and anxieties, then just keep on that path because you can feel better. It can take a long time, but you can feel better. Now, there are 2 books I want to recommend. This is Feeling Great by Dr. David Burns, and he debunks some of this medication for depression stuff. And this is research that he did quite a while ago. And then there's also The Brain That Changes Itself by Dr. Norman Doidge. And this is about holistic, movement oriented, mind pattern, cognitive behavior therapy oriented healing. And I just want to lay the groundwork for thinking about approaching mental illness or psychiatric illnesses from a holistic, nature-based perspective. And so I'm not going to go too deeply into the WPATH files and the specifics at this point. I'm going to make a series because I think we really have to examine the overfocus on pharmaceuticals in the psychological and psychiatric fields. So this is from Dr. David Burns. One of the important questions that I think has, you can extrapolate from this something about the overprescription of puberty blockers, wrong sex hormones, and overprescription towards the path of getting potentially very damaging surgeries to fix something that is in your head. So his question is, do depression and anxiety result from a chemical imbalance in the brain? For more than 50 years, this was published just a few years ago. For more than 50 years, psychiatrists have promoted the idea that depression and anxiety result from a chemical imbalance in the brain, and this idea is still popular today, but is this theory valid? We know that the billions of nerves in the brain use chemical messengers called neurotransmitters like serotonin, norepinephrine, dopamine, GABA, and many others to send messages to each other. So, and this is, there's like this electrical pinging that goes between nerves and brain cells. And so these are the chemicals that carry that electrical messaging. So when a nerve cell fires, it releases a chemical messenger like serotonin into the tiny synaptic gap that separates it from the next nerve cell in the network. The serotonin diffuses across the synaptic gap and attaches itself to receptors on the next nerve cell, causing it to fire. Early psychiatric researchers proposed that these chemical messengers may play a role in emotional problems like depression, anxiety, and even anger outbursts. Specifically, they proposed that depression results from a deficiency of serotonin in the brain, and that mania, in turn, results from an excess of serotonin. And this is disproved already in the 1970s. They used veterans who had these problems as their subjects, and they got a milkshake that had an excess of L-tryptophan, and then the other half did not. It was a double-blind study, which is the most scientifically valid. Now, you can't do a double-blind study with some kind of treatment of cross-sex ideation. You just can't do it because there are physical effects of the wrong sex hormones or the puberty blockers, and so you would be able to tell right away it couldn't be double-blind. But that is to say that this limits the research on this if you're going to go the drug route. Okay, and L-tryptophan is an essential amino acid, and it's converted into serotonin in the brain, and serotonin being considered the happy chemical. So our hypothesis was simple. If a deficiency in brain serotonin causes depression, then patients receiving massive daily doses of L-tryptophan should have experienced antidepressant effects. Sadly, there were no antidepressant effects of L-tryptophan. We published this finding in the top psychiatry journal in 1975. So I think this shows what I will interpret here is that the pharmaceutical industry has very, very much influenced medicine. And look, you know, there are necessary pharmaceuticals, and perhaps in a very severe depression kind of situation, perhaps some medication can help this person bring themselves out of this. I honestly believe that, considering it looks like electroshock doesn't work, and I don't see how they can say that the Prozac type drugs, the SSRIs, actually work, because people go on them for years. And as we know, the brain develops resistance to any drug affecting it, and then to have whatever the effect is, then the dose has to be increased. There was a time for a few years after September 11th of 2001 when I was on, I think it was Lexapro. And later, I got sick and wasn't able to keep anything down, so I wasn't taking it. And I had a sudden increase, a burst of creativity. I thought about getting back to my classroom, and I had all these plans, and I felt so inspired. And I said to my doctor, I just don't want to go back on this. I had been quite seriously ill, and I felt all of a sudden renewed. I was so thankful. And I really believe that first, there has to be a discussion with someone a patient who comes in with cross-sex ideation. There has to be a discussion of past trauma. There has to be a thorough, months-long series of appointments with the mental health practitioner regarding sexual orientation. We know from Richie Herron and Alexander L. that as a youth, these guys were attracted to other guys and didn't want to be gay, and started going into this cross-sex ideation, and both of them are detransitioners and, very unsatisfied with the results of the affirmation, the hormones, and the surgeries, which had incontinence kind of results and things like that. So I just want to lay this groundwork that there are cognitive behavior thought patterns to set yourself off on, and especially if you combine it with movement, where you are kind of getting away from the narrative inside of your brain and focusing on breathing. I suggest, just to get an idea of this, to look at my wellness movements playlist. I've been doing my wellness movements now for, a couple of years in a very focused way. I'm even redefining some of the breathing. I'm going to get back to posting some little short videos when it's warm enough to be doing it back on my deck. But that should really be part of the approach towards a patient who's coming in with cross-sex ideation. I find that with the movements I do for the whole abdominal wall, I do things for the sides and for the upper part, the lower part, and then my whole abdominal wall as a whole. What I have found is that as I move about in the world with a sense of strength in my abdominal muscles, then that is a distraction from whatever stress I might have been feeling in my throat and in my chest. And these uh, mental health practitioners are not uh, really even thoroughly discussing where in your body do you feel this stress, because we all know we carry stress in our bodies. And there was one point, it's in the book, when I was having a problem with cranial scar neuroma because I had had a big surgery on the top of my head to remove a bone tumor from the outside of my head, and the scar started bothering me. I figured out that I need to do relaxation movements for my neck, and then I deal much less with that pain. And I just remain very optimistic about a holistic, natural approach. I hope you get outside, and I really want us here to focus on what's next. What are the next steps? There are so many people putting out the raw, disgusting facts of the WPATH files and the revelations that these doctors are are engaging in malpractice. That and the thing is, they're discussing all these terrible things that are happening to their patients, how their patients are going downhill and downhill when they're on puberty blockers, when they're on wrong sex hormones. You know, they don't really discuss the aftermath of the surgeries because they stop dealing with these patients then. It's sort of like, oh, off you go, next. So they are not discussing the alternatives. They are just overemphasizing the suicide narrative, which basically one non-professional who was under the guidance of this PhD psychologist, they basically drummed that suicide narrative into him, and he engaged in that emotional blackmail of me. And I call it mass emotional blackmail on all of society that this movement has been doing. Anyway, I've been saying the Norwegian goodbye now. Please get outside, enjoy the natural world, and be optimistic. That's my message.